The ICF Training and Technical Assistance team is honored to welcome you to this California Housing and Community Development training session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services contract. I'm Chris Pitcher from ICF, and I will be hosting today's session and also presenting at today's session. Today's training session is entitled ESG and ESG-CV, a foundational overview. It is my privilege to introduce today's co-presenter, Nora Lally. Nora, will you introduce yourself?
Hi, Chris. Thanks. Hi, I'm Nora Lally, she, her pronouns with home base.
On the next slide, you will see that we have some specific learning objectives for today. I'm not going to go over them in detail, but they are here for you to review. On the next slide, we're going to talk about our training agenda for today. So we're going to talk about the background of the ESG and ESG-CV programs. We'll begin to go through each of the ESG and ESG-CV components and eligible activities, which includes street outreach, emergency shelter, rapid rehousing, homelessness prevention, HMIS, and administration. Then we'll talk about participant eligibility briefly. We're not going to go into detail on this. It's very detailed piece of information, so we're just going to hit the highlights and not go into too much detail. And then we're going to talk about other program and grant administration requirements. Our first section is going to focus on ESG components and eligible costs. The ESG program was redesigned in 2011 via the Hearth Act when it changed from Emergency Shelter Grant to Emergency Solutions Grant. The redesigned program provides funding to engage homeless individuals and families living on the street to improve the quality of our emergency shelter and the amount of shelters so that folks aren't living on the street, to operate our shelters and provide essential services to those shelter residents that are at our shelter system. ESG, Emergency Solutions Grants Program, real big change was the ability to do rapid rehousing. We did not have the capability to do rapid rehousing in the Emergency Shelter Grant Program, but Emergency Solutions Grant Program allowed us to do that. So rapid rehousing was a new activity then. We also have prevention, so keeping folks from coming into the homeless system. HUD's regulatory language for ESG can be found in these following places. You'll see the Hearth Act. You also see there's the ESG interim rule. We have various notices, and we also have the definition, the final definition of homelessness that we have. All of these links will be active in the materials provided after this session, so you can go and review each of these regulatory backgrounds yourself. The ESG program was further modified during the coronavirus pandemic and greatly expanded to nearly 20 times its size at around $4 billion for the ESG-CV program. The CARES Act states that ESG-CV funding must be used to prevent, prepare for, and respond to COVID-19 amongst those folks experiencing homelessness. We also can provide support for homeless assistance and homeless prevention activities to mitigate the impacts of COVID-19. Housing is healthcare. Folks are going to be much safer from contracting and ultimately losing their lives to COVID if they have stable housing. All right, the ESG-CV program is managed by the same notices and rules as the ESG program unless otherwise noted in an ESG-CV waiver, a notice, or a flexibility. HUD released a series of waivers and alternative requirements that specify exactly what those nuances are for the ESG-CV program. Here at the bottom of the page, you can see that the current notice that's in effect is CPD 21-08 that was released July of this year. That's going to have the most flexibilities. That includes sponsor-based rental assistance, that includes being able to work with tribal nations. Nora will go over this in more detail. So in practice, there are more than one ESG programs. There are 3 ESG programs. We have annual ESG. We have annual ESG that's specific to preventing, preparing for, and responding to coronavirus. And then we have ESG-CV. So I'm going to talk about them each separately. So the ESG program, the annual ESG that we get an allocation every year from HUD, the ESG program interim rule applies to that. The interim rule has been in effect since 2011, and it is the guiding principles for everything we do in ESG. If we decide to use prior years ESG annual funding to prevent, prepare for, and respond to coronavirus, we are able to then have the flexibilities of the ESG-CV program on those annual funds, which means we have no need for match. We're able to serve clients differently. It allows us to use those older funds more flexibly, and there's nearly no piece of our homeless service system that hasn't been affected and cannot use annual ESG funds to prevent, prepare for, and respond to coronavirus. It was such a widespread pandemic that most of our annual ESG funds, should we want to, could be used to prevent, prepare for, and respond to coronavirus. If we use prior year ESG annual funding, we have not only the rules from the ESG program interim rule, but we also have the waivers, the flexibilities, and the from the notices that apply to this program. So it looks just like ESG-CV, but it's annual ESG. The last program is obviously ESG-CV, the actual stimulus program, which again has the interim rule as its baseline, and then all the flexibilities, waivers, and notices that give us our flexibility of ESG-CV that Nora will go through in more detail. The state of California received $315 million in ESG-CV funding, which was a huge increase compared to our annual ESG funding. In California, the state of California Housing and Community Development receives funds directly from the Department of Housing and Urban Development, known as HUD. So HUD gives money to HCD. HCD then released that funding to 40 administrative entities across the state of California in 2 rounds, ESG-CV1 and ESG-CV2. Note that those 2 programs are the same program. It was simply how they received the money from HUD. They got that in 2 pieces. They put it out in funding rounds for 2 pieces. Why does this matter? It matters because ESG funds come from the federal government, distributed to California, and they're going to be held to the federal rules, the ESG interim rule, the flexibilities and waivers that are for the ESG-CV program, but also state rules and regulations are going to govern these funds as well. It is important to know where ESG requirements are located. So you'll see here in this slide that we have some state and federal rules that apply to our California ESG-CV program noted here. Again, you will have access to these materials and can click through all of these links when you get the materials posted. It's also important to understand where and how to access ESG-CV requirements. So again, we're starting with the ESG-CV notice. We also have the CARES Act here. We've included the ESG-CV1 and 2 notice from HCD since they have put additional requirements in there, such as only funds in ESG-CV round 1 applications were eligible for homelessness prevention. That is not something that came from HUD or the federal government or in notices. Those are limitations that California HCD put upon the funds as well. So both NOFAs are there. Then we have the HUD ESG program waivers listed as well. Lastly, the agreements, that's the last place where other requirements can be put in place. The agreements and proposals between HCD and communities. So all of our communities requested funds. They said, we're going to do these activities. You're held to those activities unless otherwise stated in your grant agreement. We also have the grant agreements that are very specific to what funds and what services and what components you fund out of the ESG-CV program. There are a few terms we need to understand as the structure of the state of California is complex. So we use the term administrative entity. That is almost always going to be a unit of general purpose government that HCD has contracted with to administer the ESG and ESG-CV funds. When we use the term subrecipient, we're talking about usually a unit of general purpose local government or a nonprofit that receives ESG funds from the state of California or ESG-CV funds from the state of California. In a few of our communities, like Los Angeles, we have another layer as well. So you might see the term subrecipient, where the administrative entity or subrecipient gets money, they give it to one entity, and that entity then contracts with all of the providers providing services. So we do have some complex structures in some of our communities here in California. Annual ESG funds are distributed annually by HUD and to HCD. They have differing rules. Rules differ from ESG-CV than do annual ESG. Here are the program components we're going to go through in detail today. As you can see, we will be talking about rapid rehousing. We'll be talking through homelessness prevention. And note again that in California HCD, only homelessness prevention for ESG-CV funds were approved. We did have an eviction moratorium that just recently passed that was hindering folks' ability to access these funds. And HCD is disallowing homelessness prevention rental assistance to avoid duplication of benefits and to make sure that our beneficiaries, our clients, are accessing the Emergency Rental Assistance Program, or ERAP, first, because it's more flexible and it can provide more assistance than we can to ESG-CV. We'll walk through emergency shelter and the new category of temporary emergency shelter, street outreach, HMIS, and administration. I'm going to turn it over to Nora to get us going.
Thanks, Chris. I love this visual of the frog hanging on for dear life in a very flexible fashion and talking about ESG flexibilities, because the first thing we want to talk about in this presentation is some of the new eligible costs that were added so that these funds could really respond to the public health crisis through ESG-CV or annual funds used to prevent, prepare, or respond to homelessness. So this list includes the eligible activities and costs that an ESG-CV or ESG to prevent, prepare, or respond can now do. So I will run through the list, pulling out some highlights of each of these new costs. So under the new waivers from HUD with this funding, sponsor-based rental assistance is allowable. So there's various configurations of how rental assistance is designed. Now, a new one that HUD can use ESG for is sponsor-based rental assistance. Renter's insurance is now allowable when it is something that is required by the landlord in order for eligible participants to be housed within a unit. With rental assistance, the cost of renter's insurance can now be paid. Laundry services are allowable under outreach programming. This, I think, was always something that could be included as a part of a program, but the recent notices just really made it clear that laundry was specifically eligible. Also added as a really important element of housing programs is the ability to pay for furniture and household furnishings. There's some complexities with these as far as those materials have to be retained by the program rather than transferred to participants when they're leaving the program. But it is important to know that furniture and furnishings can be paid for with ESG funds. The new notices also expanded the scope of services that could be provided in rapid rehousing and homelessness prevention. Previously, there were still services allowable, but they were really specific to what were housing related services, recognizing the increased need and the depth of services needed because of the public health crisis. HUD expanded the services that could be paid for to those that are allowable under the ESG shelter component, which is really comprehensive list of services related to job training, education, mental health, healthcare. So now the whole program has an expanded list of services that are eligible. Also allowed is specifically using funds for personal protective equipment, and now paying vaccine incentives up to $50 per dose for either the initial vaccine and also boosters in order to incentivize people receiving those critical health services. The costs of centralized or coordinated assessment are also specifically eligible under ESG, as are using cell phones and internet as a cost that a program can carry, and then be able to allow participants to be able to use the cell phones and also the associated internet services. But that's not all. There's still more new costs. Specifically listed now are hand washing stations and portable bathrooms. Volunteer incentives were added, recognizing that so many shelter outreach programs, this whole sector really thrives on volunteers. And when it became very difficult for people to continue to volunteer because of public health risk or just trepidation about continuing to volunteer, HUD allowed volunteer incentives to be added as eligible activities. Training that is specific to public health costs. You've always been able to do training with ESG, but it had to be training related to ESG, the program or the programming side. So this expands training to be for the public health costs and how do you actually prevent, prepare, and respond to coronavirus. Chris mentioned temporary emergency shelters, so emergency shelter components. The emergency shelter has always been something that's been eligible, but within the public health crisis, the idea that we need to have different options to house people and to house people quickly. So this is when temporary emergency shelters were added, which can pay for leasing or acquisition of property up to 2.5 million. And then also renovation and shelter operation and services at a structure that doesn't meet all of the same environmental and physical requirements of regular shelter. So there's a lot of information about this in HUD's ESG notice. So I'm not going to get all the way down into the specifics here, but know that there's some flexibility about what a shelter specifically needs to look like so that it can be used to respond to the public health crisis. Another new option is being able to use ESG funds to pay landlord incentives. HUD has always encouraged strategic partnerships with landlords and really incentivized relationship building, but has never paid for it. But now through the waivers for ESG, those costs are specifically eligible as landlord incentives. So those are the exciting new costs under the ESG-CV notices. And I think if we go to the next slide, there's a handy chart, which no one expects you to commit to memory right now, but it's a great reference as you're working with this program, because if you're like any of us who have worked with this program, you will have the idea, you will remember, oh, I can pay for a thing like training, but what program, what component was it eligible under? So this chart is really useful because it tracks all of those new activities that we just talked about, and it categorizes them by the component under which they are eligible. So as you continue to work with this program, I think you, like me, might find that this chart will be something you have on the wall next to you and you refer to it often. Few other flexibilities that have come through in the ESG-CV program, that there has been a reduction in the limitation on emergency shelter. So in previous noted there, in the first ESG notice, there were some time limitations on temporary emergency shelter. There was a shorter amount of time for when those program funds could be used. With the recent notice that came out over the summer, that limitation has gone away. There's also no limit for the time associated with rental assistance. Previously, there was a cap on the amount of rental assistance, and it was based on certain elements that were more at the front end of the grant management side of things. So HUD removed those limitations about the time for the amount of rental assistance that could be paid. And it also expanded the amount of rental arrears that could be paid. And then it expanded and specified some information about vacancy payments and clarified that vacancy payments were allowable for 30 days, a 30-day vacancy period after a participant has left a unit, and then when you're trying to house someone else within the unit, there's the opportunity to pay for the vacancy cost. So many flexibilities. But before jumping in and using those flexibilities, it's important to do the background work to make sure that, and you look at that chart that had the components, to make sure that those are the funds you're receiving. Oh, hey, I remember that new cost now. Is that the kind of project that I'm funded for? Is that allowable to me because I am doing rapid rehousing? So, oh, okay, I can use those new costs that are allowable for rapid rehousing. So important to check for that. Also important to look at your written agreement, your contract. Sometimes those have additional things that you either have to do or that you may not do. So always check your written agreement, and also always check with whoever is your administrative entity if you're thinking about making a change or adding costs. You want to make sure that they're aware of what you want to do. Also talk through if there's any change to any documentation that would be required, or any other of those kinds of specificities. So that's just a little bit of work that you want to make sure you do before you jump into spending on those new costs. A few more flexibilities relate more to the housing piece of the action. Subleases are now allowable. There's a specification that if the housing relocation and stabilization services are the only cost being paid in a prevention program, then you don't have to do the habitability or HQS inspection. And it also increases the amount of time that case management can be provided while participants are seeking housing. Next slide. Still more flexibility relates to now the opportunity to be able to issue subawards to tribes or tribally designated housing entities. With temporary emergency shelter that we talked about, if the need for the temporary emergency shelter ends, that shelter can now convert to a standard emergency shelter without triggering some complicated disposition requirements that were presenting a barrier to thinking about the future of temporary emergency shelter. So those no longer apply. And also HUD clarified the income standard for homelessness prevention and made it consistent across all the different elements of prevention. So consistently, the income standard for homelessness prevention is 50% of area median income. So that is a lot of new information, a lot of good flexibility through for ESG-CV or annual ESG-CV to prevent, prepare, and respond to coronavirus. And Chris is gonna give some more information about each of the eligible components.
Thanks, Nora. Yeah, we will start our ESG components conversation with street outreach. So street outreach is eligible for folks that meet category 1 or category 4 of the homeless definition in an unhoused situation, unsheltered. So this is families and individuals who are unable to access shelter or maybe unwilling to access shelter. And they're living on our streets. They're living in places not meant for human habitation. This is a really important component for the ESG and ESG-CV programs. Note that essential services can be provided to eligible participants where they're at, on the street, in parks, in abandoned buildings, and staff salaries related to carrying out the street outreach activities are also eligible. We're going to go into each piece of it. We'll start with engagement. Engagement is a critical component of street outreach, as the relationship between a street outreach provider and a client experiencing unsheltered homelessness is critical to getting them into housing. So engagement is extremely important within the street outreach program to make sure that we're building those trust, building those relationships to really help folks get where they need to go, how to get folks to get off the street. So engagement includes activities to locate, identify, build those relationships with unsheltered folks for the purposes of providing immediate support, intervention, and connections to homeless assistance programs or other housing or mainstream resource programs. Engagement is really important. We'll say the same thing in the next slide on case management, that we're engaging folks in an effort to end their homelessness, to get them off of the streets or not living in places meant for human habitation. You can see the eligible costs are here, including providing initial assessment, making sure that folks are eligible, providing crisis counseling, addressing any urgent physical needs, connecting folks to other providers, providing referrals, and then cell phone costs for outreach workers. Case management is also critical to street outreach. Accessing a case management service for someone experiencing unsheltered homelessness is critical to engaging them in a conversation to get folks into housing. One of the things that we've seen street outreach evolve to in the recent years is we used to have a really big focus on keeping folks safe and helping them survive on the street. We're really seeing a lot of street outreach programs, specifically the ESG-CV program, focused specifically on housing focused street outreach to get folks into housing. That's the thing that will end their street homelessness. So the costs that are eligible for our case management services, participating in coordinated entry. Many of our street outreach providers are coordinated entry access points. They're getting folks into coordinated entry. Doing that initial evaluation and documenting eligibility, providing counseling, developing and coordinating developing, securing and coordinating services, obtaining benefits, state, local, or federal benefits, monitoring the progress that our folks are making, providing information and referral, and then developing that service, really focusing on housing. Street outreach also provides a myriad of other services, and we'll start here with emergency health services. So these are outpatient treatment and other urgent medical services provided by licensed medical professionals in the community settings, so in the streets, in the park. These services are eligible only to the extent that other appropriate health services are not accessible or unavailable in that region, in that area. Costs include assessing folks' health, developing treatment plans, making sure that participants understand their health needs, helping participants obtain medical treatment, and providing medication and follow-up services. Similarly, we have the ability to provide mental health services as part of our street outreach activities. And these are urgent mental health conditions that can be addressed by licensed professionals, again, in those community-based settings. We're going to the streets, we're going to the parks, we're helping folks de-escalate and get the services they need. Again, these services are only eligible to the extent that other appropriate mental health services are inaccessible and unavailable within the area, which is oftentimes the case. The eligible costs here are working in crisis intervention, helping with prescription of psychotropic medications, explaining the use and management of those medications, and combining all of that with a therapeutic approach to help any mental health crisis that may arise. We also can provide transportation. Transportation is pretty straightforward. We can pay for travel of the outreach workers or social workers or other medical professionals to go out and provide eligible street outreach services to folks in an unsheltered situation. The eligible costs can be transporting unsheltered folks to emergency shelter or other facilities, giving folks the ability to use public transportation. We also can allow mileage for outreach workers to visit encampments or folks in an unsheltered situation. We can purchase or lease vehicles for conducting outreach. That includes gas, insurance, taxes, and maintenance of those vehicles, and costs of staff to occupy or assist participants to use public transportation. Next is our special services, our services to special populations. So you will see that all the eligible costs that I've determined, that I've described so far, engagement, case management, emergency health and mental health services, transportation, are all also eligible for our special populations. So these are essential services that are tailored to address the specific needs of our homeless youth population, those experiencing domestic violence or other related threats, or folks living with HIV/AIDS. Our second component is emergency shelter. An emergency shelter is one of the more complex components we have in the Emergency Solutions Grant and ESG-CV programs. So I'm going to go through this in the same detail we just went through street outreach. Eligible participants are those that are in categories 1 through 4, the homeless definition, individuals, families who are homeless and needing to access emergency shelter, crisis shelter services. We can provide the eligible activities of essential services to persons in the shelter. We can renovate buildings to be used as emergency shelter, and we have operating costs for emergency shelter. Staff costs related to carrying out emergency shelter in both essential services and operations are also eligible. So there are three main emergency shelter funding options. The first is essential services to persons in emergency shelter. We'll go through that in detail. The second is operations. And the third is is shelter renovations, rehab and renovations, which we don't typically see a lot of. But with the increase of ESG-CV funds, we have seen more of it recently than we have in recent years. So I'll start out with essential services. They're integral to the operation of emergency shelter and include the ability to provide case management, childcare for those with children who need to work or get education services, employment assistance and job training, legal services to remove those barriers to housing, life skills, mental health services, outpatient health services, substance abuse treatment services, transportation, and again, services of special populations. We'll talk about emergency shelters specific to domestic violence victims, to youth, and to those with HIV/AIDS. So case management should be focused again on housing folks. We have folks in shelter. We don't want to keep folks in shelter longer than we need to. We want to get them into a stable, permanent housing environment as quickly as we are able, and case management is so critical to that. Whether it's the use of coordinated entry to get folks on a rapid housing waiting list, or maybe a permanent housing list, conducting initial evaluations and verifying documentation and eligibility, counseling our clients, developing and securing other services with federal, state, and local benefits, making sure folks make progress within our plan to become permanently housed, providing referrals, and risk assessment for those who are fleeing domestic violence. And then ultimately that housing plan. That's really the goal of case management, is to get folks the services they need so they can leave the shelter and get into a stable, permanent housing environment. We'll talk a little bit about childcare here. This is licensed childcare for program participants under the age of 13. That age is 18 if folks have a disability. We can pay for. Eligible costs include the cost of childcare, meals and snacks, and comprehensive and coordinated sets of appropriate developmental activities, learning opportunities. Moving on, we have education services. This includes the instruction or training to enhance participants' ability to maintain their housing. So maybe it's a literacy training. It could be English as a second language or GED, some consumer education, health education, substance abuse prevention, harm reduction type activities. Eligible costs include education services, skill building services, screening, assessment, and testing, individual or group instruction, tutoring, provision of supplies like books and other instruction material, counseling, and then ultimately referral to other community resources. Connected to education, we also have employment assistant and job training assistance, which allows us to provide classroom or online computer access, on-the-job instructions, and other services assisting participants to secure that employment, to secure those skills they need to retain the job, and to increase their earning potential, which will increase their ability to stay permanently housed. Eligible costs include reasonable stipends, employment assistance and job training programs, acquiring vocational licenses or other certificates, employment screening, assessment, and testing, books and instructional materials, structured job seeking support, so really helping folks access job opportunities, special training or tutoring, including literacy or other pre-vocational trainings, counseling, job coaching, and then again, referral to other community resources as needed. Outpatient health services are direct treatment of medical conditions provided by licensed medical professionals. Again, just like street outreach, these services are only eligible to the extent that the appropriate health services are not available in the area or near the shelter. And you can see the eligible costs consist of assessing health problems and developing treatment plans, assisting program participants to understand their health needs, providing and helping participants to maintain their medical treatment, including preventative medical care, and health maintenance services, including emergency medical services should they be needed, helping with medication and follow-up services, and then providing preventative and non-cosmetic dental care, which is a large issue that is greatly covered. Next is legal services. So these are hourly fees for legal advice provided by licensed attorneys or their staff regarding matters that interfere with program participants' ability to retain housing. We have lots of issues around legal issues around clients that could lead to us not being able to house folks, like child support, guardianship, paternity, emancipation, domestic violence-related protective orders, public benefit denial claims, resolution of criminal warrants, and legal services can often help us reduce these barriers to housing. These services are only eligible to the extent that other appropriate legal services are unavailable in the area, and these are provided in an emergency shelter setting. They're not a standalone project for legal services. This is within the emergency shelter itself, where we can do client intake, prepare for trial, represent folks at hearings, work with court costs and filing fees, and ultimately just counsel folks within the legal services service. Life skills training consists of those skills necessary to help folks live independently in their own or in shared permanent housing. Really making sure that folks are stable, that they can maintain their housing once they are able to obtain housing. And those eligible costs include budgeting resources and managing your money, managing conflict within a household, resolving conflict within a household, shopping for food and other needed items, making sure we improve our nutrition, the use of public transportation, and ultimately also some parenting skills. Mental health services, again, cover mental health conditions that are treated in an outpatient treatment setting by licensed professionals. Again, these services are only eligible to the extent that other appropriate mental health services are unavailable within the area and cannot be accessed near the shelter. We can provide similar costs here under the eligible cost with crisis interventions, therapy sessions, whether that's individual, group, or family, prescription of psychotropic medications, and explanations on how to use and manage that medication, and then combinations of therapeutic approaches to address multiple mental health issues. Like mental health, substance use treatment services are eligible to be provided in an emergency shelter setting provided by a licensed or certified professional designed to prevent, reduce, eliminate, or deter relapse of substance abuse or other addictive behaviors. These services, again, are only eligible to the extent that their other appropriate substance use treatment services are unavailable in the area and not easily accessed by shelter residents. And the eligible costs consist of client intake and assessment, outpatient treatment for up to 30 days, group and individual counseling, and drug testing. Just like street outreach, we have the ability to provide transportation. Transportation looks a little bit different in emergency shelter, but it's fairly similar. We can pay for the costs of travel by program participants to and from medical care, employment, childcare, or other facilities that provide eligible essential services for the clients that reside in an emergency shelter setting. Also, the cost of staff to travel and support the provision of those essential services. Eligible costs include travel and public transportation, mileage for service workers using their own vehicle, the purchasing of or leasing of vehicles, including gas, insurance, taxes, and maintenance, and then travel costs of staff to accompany program participants, emergency shelter residents to use public transportation. And finally, just like street outreach, we have the same services I went through: case management, childcare, employment, education, health, mental health, life skills, legal services, transportation, and substance use can all be tailored to address special populations within emergency shelters, including youth, victims of domestic violence, or those fleeing domestic violence, and HIV/AIDS. So moving from our services to the other categories that I mentioned before. So the second type of emergency shelter support is renovation, rehab, and conversion. This includes us renovating buildings that can be used for emergency shelter, the cost of labor, materials, and tools to accomplish a shelter, other renovation costs, major rehab for shelter, conversion of buildings to shelter, And then again, renovation or major rehab of those buildings. There are, however, minimum use requirements should we begin to use emergency solutions grant or emergency shelter grant funds, emergency solutions grant or emergency solutions grant CV funds for rehab. So we'll talk about each of these individually. So for major rehabilitation, which is described as a rehab cost that exceeds 75% of the value of the shelter prior to rehab, there's a 10-year use minimum requirement for those funds. Similarly, if we use funds to convert a building into shelter and those costs exceed 75% of the value of the building after rehab, we would then have a 10-year use requirement of that facility for an emergency shelter. If we do other renovation that are less major and a little bit more minor, and if those rehab costs are 75% or less of the value of the building before rehabilitation, a 3-year use requirement is levied upon that building. Lastly, we'll walk through some shelter operations. Shelter operations are the cost that we use to operate and maintain emergency shelter and provide emergency housing and shelter when appropriate. When we have no emergency shelter available, we can use hotel motel vouchers to house folks under shelter operations. Eligible costs include maintenance. This is minor rehab, so not like the major rehabs we talked about in the last slide. Rent, security, fuel, insurance, utilities, food, furnishings, and equipment, supplies necessary to operate the shelter, and again, hotel and motel costs should we have no shelter available. In very rare circumstances, we may see the use of emergency shelter funds for the uniform relocation assistance. It is very rare. If we do use emergency shelter funds for this, we must follow the eligible costs outlined in the CFR noted here, 576.408, that tells us the rules around doing relocation payments and other assistance to persons displaced by a project assisted with ESG funds. Again, these happen very, very rarely. That concludes our work on shelter. Does not include our work on shelter. Nora, was this a slide you were going to take?
This is mine. Yep.
I thought so. Okay.
Yeah. Yeah, thanks. Yeah, and this slide just wants to draw a distinction about services for shelter and clarify something that can sometimes become a little tricky, a little thorny. So we just want to draw attention to the fact that when people are residing in an emergency shelter, they can receive essential services either at the shelter or in a separate location that the agency might have. However, if people are receiving services at the shelter, that they're on shelter or they're walking in, then those services can only be provided at the emergency shelter. So say, for example, a homeless shelter offers a day services program where people can walk in. That can be funded under the emergency shelter component, but it has to actually physically be located at the emergency shelter. That's something, that distinction sometimes I think gets complicated, so we wanted to draw attention to it. And that's the last slide about emergency shelter. And the next program components that we're going to talk about together, because they're kind of twins in some regard, are rapid rehousing and homelessness prevention. These are the resources that really get to that rental assistance piece that Chris mentioned earlier that is new under the Emergency Solutions Grant Program. So the eligibility at the participant level for homelessness prevention, that does have an income limitation. Homelessness prevention for ESG-CV or annual ESG to prevent, prepare, or respond to homelessness is 50% of area median income. And then the categories of homelessness are category 2, 3, or 4, or the at-risk of homeless definition. So that's who can be served under homelessness prevention. Under rapid rehousing, there is no income standard. You don't have to determine 50% or any percent of area median income. Eligibility is really based on the fact of the person's situation of literal homelessness, they need to be rapidly rehoused, meaning they are in literal homeless, which is category 1, or fleeing or attempting to flee situations of violence when they had previously, and they are also on the street or in a place not meant for human habitation. But there is, like I said, no income limitation for eligibility with rapid rehousing. The basic eligible activities are rental assistance, short-term rental assistance, medium-term rental assistance, also housing relocation and stabilization services. Important to know here that although it's not a specific line item in the HUD regulation, the salaries related to doing all of these things are also eligible. So the staff salaries and costs of supplies, anything that is related to carrying out rapid rehousing and homelessness prevention is eligible under those activities. So the costs of those activities are eligible under them rather than a separate line item somewhere else. We'll talk a little bit more about what the financial assistance and services look like. So of course, there's the rental assistance cost that can be paid for. But we all know that rental assistance is only one piece of the puzzle when it comes to rehousing someone or keeping them housed in a stable situation. So that also includes eligible costs like moving costs, application fees, security deposits, last month's rent, utility deposits, and utility payments. Those are additional financial assistance resources. And then there also are service costs included: housing search and placement, housing stability case management, mediation with landlords, legal services, credit repair, and like we talked about earlier, the list of services has now been expanded to include all of those same services that Chris went through related to emergency shelter. Any of those are also eligible for rapid rehousing and homelessness prevention programs. Next slide. This is another one of those handy charts that you might want to keep handy either on your wall or on your screen, because it does track the differences between annual ESG and then ESG-CV or ESG used to prevent, prepare, and respond to homelessness, because there are some differences about the eligibility. So I'll just walk through them. The income is different for annual ESG and ESG-CV. 30% area median income for annual, 50 for ESG-CV. In annual ESG, there can be, it's more a programmatic, more, situation by situation requirements about program participation, but specifically in ESG-CV, the notice prohibits requiring participants to receive services to participate in treatment. There is a clear language that programs can't put requirements on individuals, on clients to perform certain service-related activities. Everything is more client-driven, client-focused. Of course, services are offered and encouraged and clients are engaged, but they cannot be required. ESG-CV has landlord incentives as a new cost. And also under ESG-CV, the timing for when reevaluation occurs was adjusted, more time between evaluations. So it's every 6 months for homelessness prevention, and it remains annually for rapid rehousing. And also very excitedly, the match requirement, which was 100% cash or in kind for annual ESG on the recipient's total allocation. There's no match requirement for ESG-CV. The differences here are also to show that a little bit about how the regulation looks just in a chart form instead of the text form. So we consider short-term rental assistance to be up to 3 months, and medium term is 4 to 24 months. Rental arrears are a one-time payment of 6 months, And then for ESG and the annual ESG, the limitation on rental assistance up to 24 months in any 3-year period is waived. So that 24-month limit doesn't apply to ESG-CV. So along with another component, switching from housing related costs, these are the costs that are more on the program as a whole. Administrative costs are those that relate to actually monitoring the program, planning for ESG. They're more the big picture kinds of costs, and recipients with ESG CV can use up to 10% of the grant to pay for these costs. And remember, because it's such an important point, I think it often gets a little bit complicated or lost, is that these are not the costs that relate to the overhead of directly carrying out either rapid housing, homelessness prevention, outreach, any of those things we just ran through. The costs associated with them are charged as a part of those activities rather than under administration. A specific review of what you actually should be charging under administration, like we said, they're the overall costs of program management, coordination, monitoring, and evaluation. So what does that look like? What does that mean? That means travel costs if you are doing on-site monitoring of subrecipients. It means if you are contracting out for any of your administrative costs, if you have a back office contractor to help with your billing, with your reviewing of vouchers, that would be eligible under an admin cost. Other costs related to the administration, like the supplies for the person who's doing the monitoring, or the equipment to print off the subrecipient voucher documentation. Those costs, because they are related to the administrative function, are charged under the administrative activity, as are the salaries and wages of the staff who are conducting those activities. Other things you can do with administration, this is where we talk about training on ESG requirements. That's where this one goes. If at the planning level, you are involved in preparing data or information for the recipient's consolidated plan, this is where that time and resources would be charged to that consolidated plan activity. And also the costs of carrying out environmental review are charged under the administrative line. There is a requirement for some of these funds to be shared as we go through the, as the money flows down between from recipient to subrecipient, and all the way, as far down the ladder you can go. There are some ways in which the regulation compels the administrative funds to be shared. So if the recipient is the state, there's a requirement that it must share its funds with subrecipients that are units of general purpose local government, and that it may share with subrecipients that are private nonprofit organizations. So if the state is sharing its subrecipient to a unit of general purpose local government, it has to share some of its administrative funds. If the recipient is a territory, city, or urban county, it may share its funds. So HUD wants to make sure, puts a little bit of requirement on who has to share admin funds, and then allows those funds to be shared in other situations. Indirect costs are allowable under ESG. They are allowable. Indirect costs are detailed, regulated, specified within 2 CFR 200, which is really the playbook for all things financial related to really any federal government resource. So 2 CFR 200 spells out the differences between indirect cost that has a cost allocation plan as approved by a cognizant agency, or indirect costs that are used under a different standard, which is the 10% de minimis standard. I will say indirect costs are quite weedy and complex. This is a great area to tap your accounting staff, your treasurer, your auditor to really dig into these requirements, make sure that how your approach to using and keeping records for indirect costs is in line with what's spelled out in 2 CFR 200. Okay, so we made it through all the eligible costs. Within those conversations, Chris and I detailed, we talked about eligible participants, and we talked about it by category: category 1, category 2, category 3, category 4. It's possible that maybe you've never heard those terms, or even if you have, it's also hard to remember exactly what those different categories would mean. So in the next section, we're going to talk about the homeless definition as HUD does, which is by using a terminology of categories, which is not to try to put people into categories. It's really to say that situations of housing and housing instability are so complex and varied that there had to be a little bit of differentiation to just try to understand a bit and in a way create a common language that both HUD and other programs implementing entities could use when trying to understand the differences. So on this chart, this is a high level view of by the different components, what the different categories of eligibility are for each of those components. So this is also one of those ones, handy reference guide that you can use in the future. And if we go to the next slide, then that's when I'll really start talking about the differences in the categories of homelessness. So within that homeless definition, there are 4 categories. Category 1, literal homelessness. Category 2, imminent risk of homelessness. Category 3, unaccompanied youth who meet a different federal statute. And category 4, individuals or families fleeing or attempting to flee situations of violence. I'm going to talk about each one in a little bit more detail. That's it, you can keep it on that other slide. Actually, we don't have, we left it at a high level because I think this is one of those topics that you either can talk about a little bit and give, a basic overview, or you could talk about it all day. We are believing you probably all don't want to sit here all day and listen to me talk about this. So we're going to give more of the high level, but know that there are a multitude of other resources available to provide more detail about these definitions. So the literal definition of homelessness, category 1, is for people who are sleeping on the street or in a place not meant for human habitation. So this means people who are on the street, in a car, in an abandoned building, sleeping on the in a bus, using public transportation as a place to shelter, or a train station or a campground, places that aren't intended for people to stay in. That's one element of the category 1 definition. A second element of the category 1 definition is people who lack a fixed adequate residence and are in a shelter, transitional housing, or a motel or hotel paid by a third party. So living in a shelter makes sense. Living in transitional housing, I think, is sometimes an area that gets overlooked as where people still meet a situation of literal homelessness if they are staying in a program that is considered transitional housing. And also people who are in a hotel or motel that they are not paying for themselves, but is being paid for by a third party. They are what all considered under the category 1 definition, literal homelessness. The third element of the category 1 definition is people who have been in an institution in a hospital, in some sort of, a rehab facility, in any kind of an institutional stay for a certain period of days. The ESG-CV notice expanded the number of days to 120 days. And for annual ESG, it's 90 days. So if you were literally homeless and then you had to stay in an institution of up to 120 days for ESG-CV, you would still be considered to fall within that category 1 literal homeless definition. So that is the very, very basic outline of category 1 of the homeless definition. And just as a reminder, the eligible components for category 1 under ESG are street outreach, emergency shelter, and rapid rehousing. So we'll go next to the category 2 definition, which is individuals or families who will imminently be homeless, meaning that they will lose their primary nighttime residence within 14 days. There's also some specificity, some requirement that there's no other resource identified and they don't have any resources or support networks to obtain other housing. And when we talk about losing housing within 14 days, this could be either housing that is owned, that is rented directly from a landlord, housing that's shared with others, or if living in a hotel or a motel that is not paid for by program or by someone else. So in these situations, it's about being about to lose housing and having no other resources to be able to provide or to establish housing. So that is the imminent risk category. And the programs, the components that go along with category 2 for ESG are emergency shelter and homelessness prevention. Homelessness prevention, provided they meet those income limits that we talked about previously. Category 3 is an expansion to include unaccompanied youth or families with children and youth who meet the homeless definition under another federal statute. A lot of what in the creation of this regulation, a lot of what the information and the need that was shared was children and youth, unaccompanied youth who meet maybe the McKinney-Vento definition, which is different, or the VAWA definition of homelessness, which is different. And they were, in a way, falling through the cracks of eligibility for the HUD programs because the definitions just didn't quite align. So for those situations, for youth, unaccompanied youth, or families with youth who meet one of the other federal definitions and who haven't had a lease or haven't owned a home within the past 60 days and have had to move frequently, meaning I think 2 or more moves in the past 60 days, when they can show that they meet one of those other federal definitions, and then that makes them eligible under category 3 of the HUD homeless definition, which allows them to be eligible for HUD's emergency shelter program or HUD's homelessness prevention program, again, provided with the homelessness prevention that they meet those income limits. And then the last category of the homeless definition is category 4, individuals who are fleeing or attempting to flee domestic violence. And this is really not limited specifically. It is meant to be allowable broadly to include individuals fleeing other dangerous, life-threatening conditions related to violence against the family member, an individual, or a child, either that has taken place in the primary nighttime residence or the individual or family makes them afraid to return to that residence. Households that are fleeing or attempting to flee domestic violence also have to have no other residents identified, and also have no resources or support networks to maintain other housing. So it's people, so there's the idea that it's people who are in unsafe situations and have no other resources. That is when category 4 applies. And the eligible components for the ESG program include outreach, emergency shelter, and rapid rehousing. So I know that was really a lot of information. We really just wanted to not go all the way down deeply into the conversation, but to really create, I think, the outline, create the framework, establish the understanding that for the various ESG components, there are eligibility requirements that relate to the situations that people are in. So hopefully that's been enough to at least provide that general framework. And there are always other resources and more specificity about it that can support your understanding, and then program design and implementation around those. Chris, I think it's back to you.
Thanks, Nora. And we've had a chance to walk through the ESG and ESG-CV program, the rules and regs. We've talked about the components of the ESG and ESG-CV programs. We've now got eligible activities, eligible clients. We're now going to focus our energy on other requirements. So the general requirements for ESG that we'll discuss and ESG-CV include the participation in the Homeless Management Information System, known as HMIS, how coordinated entry in ESG and ESG-CV operate together, and then ultimately how we operate our ESG and ESG-CV programs with written standards, formal written standards at our community partners, so everyone knows how services ought to be funded and operated, and then also a process for termination, which we'll touch on briefly. HMIS is a requirement for all ESG and ESG-CV funds. All providers that receive ESG or ESG-CV funds must enter data into HMIS, unless you're a domestic violence provider, in which case you must have a comparable database. A comparable database is defined as a data system that can do everything that an HMIS can do. So all the reporting, be able to send a CSV file to Sage for your quarterly report or your monthly or your annual report, your CAPER. You're required to submit annually a CAPER report for ESG annual funds, and for ESG-CV, we require a CAPER report every quarter. You note here that we have an ESG HMIS program manual that was just updated to reflect the 2022 data standards, so you may want to access that. Note that all ESG program recipients and subrecipients are required to collect the universal data elements, and depending on the funding source, different or specific types of program-specific data elements. These data are collected and they're used for the consolidated plan reports, and again, the CAPER, which for ESG is annual and for ESG-CV is quarterly. After we talk about HMIS, coordinated entry is our second topic, and CES is a requirement for homelessness prevention, rapid rehousing, but other programs might be required to use coordinated entry via the written standards that the community has for ESG and ESG-CV. This may detail the use of coordinated entry for emergency shelter, or how street outreach is an access point for coordinated entry. So generally speaking, all ESG programs except domestic violence, victims of domestic violence service providers are required to participate in, accept referrals from, coordinated entry, use the standard assessment process established by the continuum of care, the prioritization criteria established by the continuum of care, and be part of the referral process, whether you're sending or receiving referrals, so that we can make sure that all folks experiencing homelessness in our communities have access to housing opportunities in a coordinated fashion. And not a haphazard fashion. All programs receiving ESG and ESG-CV funds also must have written standards that detail how our programs will determine and prioritize who is eligible to receive our services, determine the amount or percentage of rent rent utilities that folks would pay in a rapid rehousing program, for instance. It would determine how long a particular participant can be provided service. That is obviously no longer than the HUD provision of service, but it could be less if the community decided so. and an identification of whether and how the amount of assistance is adjusted over time. Do we have a voucher that goes down over time? In California, California HCD passes this requirement on to their administrative entities or subrecipients to assure that every community has written standards that should be up to date and include ESG-CV elements. A little bit more on written standards here. Recipients and subrecipients must develop and use local policies and procedures for keeping records of clients. Must be able to create a systemic approach for intake staff to screen potential applicants, who gets service and who doesn't. Establish protocols for collecting and maintaining all the required backup documentation that the ESG and ESG-CV programs require, and then ensure that all records are maintained for all persons that are assisted in programs, including those that are screened but found to be ineligible. So transitioning from written standards to documentation, we'll talk a little bit about what we need to document as far as client eligibility, to produce the data we need, to produce the documentation we need rather for HCD and HUD to conduct its monitoring activities of the ESG and ESG-CV programs. So when it relates to documentation, we must have policies that establish our order of preference for how we document eligibility. That includes third-party documentation, which I'll describe in more detail on another slide, intake worker observation, or self-certification from those accessing services. We also should have documentation around any discharge paperwork or anything that we have in HMIS that shows services were received through an ESG or ESG-CV program. So we'll talk a little bit about the order priority in a little more detail, and I'm going to go from bottom to top, even though that seems probably counterintuitive. We'll talk about the weakest type of documentation that we allow, which is first party. The self-certification of a person experiencing homelessness. They would come in and say, I certify that I'm homeless, and we'd be able to do that. There are some limitations. We always want to document our due diligence in attempting to achieve a higher level of documentation, third party. If we use this, we also must include some specific locations and time periods to have the clients self-certify that that was where and when they were homeless. The second level of priority is second party. So this is written observations by intake workers or other professionals in the homeless services field that say, yes, I've seen this person be homeless. The limitations here are we still have to document due diligence to try to attempt the highest level third-party documentation. And we must include specific circumstances or conversations that led us as the certifying second party in our professional judgment to make sure that the information is appropriate and that they're eligible. So we're going to have a little bit more level of information on that. Our strongest strength of documentation is third party. And this can come from HMIS if we know the person's homeless because we see them in HMIS and they've experienced homeless several times at other partners, maybe on the street, or we can also see the same thing from a comparable database used by domestic violence programs. Maybe it's a written referral from another service provider in our community. This could include law enforcement or healthcare, or education, or other homeless service professionals that say, here's a referral and tells you the specifics of what happened when we encountered the client and can say for third party that yes, they are meeting the definition of our homeless programs. Could be written observations by frontline staff or street outreach workers that have worked with the clients, or observation by other community workers, or written certification by housing or service provider in their professional capacity. All would meet a higher level of documentation acceptance for third-party documentation. There are exceptions to the preferred order. The lack of third-party documentation must not be the barrier to housing. It must not immediately keep people out of shelter. It must not keep folks from receiving services in the street outreach environment, and it must not prevent access to domestic violence or domestic violence or services therein. Protecting the safety of individuals fleeing or attempting to flee domestic violence should always attempt to obtain third-party referral only if the safety of the individual will not be jeopardized, which is oftentimes not the case. So for domestic violence folks, we are much more careful in how we document. We also need to evaluate folks' need. We're required to evaluate programs' eligibility and that they need our services. So you must conduct an initial evaluation of all households that present for assistance to determine if they're eligible for the ESG and ESG-CV programs. If they're eligible, what type of assistance is necessary for that household to stabilize, for that household to get into stable or permanent housing. Do they meet income eligibility if they were looking for homeless prevention services? This must comply with all of our ESG written standards and how our coordinated entry system works within our continuum of care. Note some of these items around participant eligibility. Income criteria does not affect our ability to provide street outreach services, emergency shelter, rapid rehousing at that initial evaluation. Participant eligibility does matter in rapid rehousing at our annual recertification or annual evaluation. Then we want to have folks not exceeding 30% AMI. For our homeless prevention programs, that initial evaluation AMI is at 50%. And 6-month reevaluation of homeless prevention also at 50% AMI. And note that we're using annual income, not adjusted income. And finally, our evaluation must use a standard for calculating annual rent established in the 24 CFR you see on the screen. We can use the CPD income eligibility calculator that you see linked on this. During the next 12 months, we're anticipating some more guidance around Part 5, Section 8 definition. It talks about gross income. And the definition specifies inclusions, exclusions, and treatment of assets, things that we don't have in our earlier evaluation tools. We should avoid terminating assistance and services at all costs, everywhere in our homeless program system, noting that it's always better to try to work through issues and concerns with clients than just terminate them. We want to avoid those in the rarest circumstances. Recipients and subrecipients are allowed to terminate ESG assistance if participants violate the rules of the program, but these should not be barrier rules. These should be rules that are flexible, that do not screen folks out or do not inadvertently terminate assistance for folks in a process that is not completely transparent. Assistance to a program participant or client who has been terminated from a program, they can receive services at a later date. It shouldn't be a lifetime ban or anything like that. We must establish a formal process that recognizes our individuals' rights and allows terminations only in the severest cases that we have. Our services should be designed to limit the circumstances that lead to termination. We should try to mediate, we should try to work. Having folks cycle in and out of ESG and ESG-CV programs from homelessness to the street because they're not following program rules is not good for the program, nor is it good for the client. Note one last item. We've talked a lot about prevent, prepare for, and respond to coronavirus, the ESG-CV mantra. This is not documented for each program or participant in the household. We recognize that the pandemic, COVID-19, has affected nearly every single person on the face of the planet in some form or fashion. So we're not asking you at the client level to say, client, have you been affected by coronavirus? We understand that that's the case. Specifically in the state of California, we document this at the ESG component level. So that's street outreach, emergency shelter, rapid rehousing, homeless prevention, and HMIS. And we do so, we tie that back, we call it the PPR tie back, prevent, prepare for, and respond to tie back. We do that in IDIS, the Integrated Disbursement and Information System. So that's held at the state of California and not anything that our subrecipients or administrative entities need to deal with. You'll see here, there's more information available on the prevent, prepare for, and respond to tie back on that link that will be in the final materials. With that, I'm going to hand it back to Nora to finish off our slides for today. Nora?
Thanks, Chris. Yeah, we have just a couple slides on some basic grant administration functions, because there will be an entirely separate webinar that really gets into specifics about grant administration requirements. But there's a couple things we wanted to bring to your attention. Grant-based accounting is the idea that federal funds have to be connected to the specific grant, the specific money under which they were awarded. So this is relevant right now because we know that in a lot of communities, there are a lot of different kinds of resources, as well as possibly multiple types of ESG assistance that you're receiving and managing at the same time. So it's important, because of this grant-based accounting requirement, that you're able to connect expenses back to specific grants, because that is how the HUD and those requirements into CFR 200 expect that all federal funds, not just ESG, will be tracked and accounted for. There'll be a link for more information, should you care to read it, about the concept behind grant-based accounting, but that's the basic idea of what you should know for your purposes. And on the next slide, I think we have just a little bit of information. Some of the systems that have been mentioned previously, we'll highlight them here. ESG funds are drawn from HUD through IDIS. How's that for a sentence that's all acronyms? IDIS is the Integrated Disbursement Information System, which is how ESG recipients, so that would be the state of California in this instance, how they draw money and how they do their reporting to HUD about the accomplishments. So in case you've heard that acronym and you wonder what it was, that's what IDIS stands for. Using IDIS, that data, both about expenditures, accomplishments, and then HMIS data about number and situations related to people who you're serving, is reported annually to HUD through the Consolidated Annual Performance Evaluation Report. That's the one report per year for annual ESG funds. The Recovery Act funding, the CV funding, has more frequent reports, quarterly reports that also are submitted to HUD. So there's both an annual report and then quarterly report. And HUD is using that information to look at performance, to look at expenditures. They will use it in the future to be able to assess risk and look at areas for performance improvement and monitoring, and also to share that information with COCs to enable performance improvement and collaboration. So those are a few high-level grant administration behind the scenes things to put all of this in context. And I believe that wraps us up.
Thanks, Nora, and thank you for attending this California Housing and Community Development training session offered through the Emergency Solutions Grant Coronavirus Relief Consulting and Staffing Services contract. Please note that this training series features over a dozen sessions that you can view at your leisure.